Hello, this is Dr. Keith Newby with Fort Norfolk Medical Associates and the James E. Newby Jr. Foundation. Let's Talk Health is a medical minute production designed to educate and enlighten our community on various healthcare topics, the goal of which is to help you achieve your optimum health, both physically, mentally, emotionally, financially, and spiritually. Each week, I will address a different topic relevant to our everyday lives. So let's get started. Today, we will be continuing our discussion on heart disease. I like to place heart disease in 4 different categories. First is coronary artery disease, second, congestive heart failure, third, valvular heart disease, and fourth, arrhythmias. I oftentimes will use analogies when I teach patients, as I do believe that if we use things we can relate to, it makes it easier to understand. So typically, I like to compare the heart with a house. In your house, you have your floors, your ceilings, your walls, your foundation, rooms. You have doors that separate room to room. You have electrical circuits in your house, and you have plumbing in your house. Well, let's look at the heart similarly. If you look at your heart, saying the actual heart itself is the foundation, the floors, the ceilings, all that is like the heart itself. Now you have rooms in your heart, and they're called chambers, and you have heart valves that are like doors that separate the chamber to chamber. So you also have your plumbing in your house, like you have plumbing in your heart, and that's the coronary arteries. And then you have your electrical circuits in your house, like you have electrical circuits in your heart. The electrical circuits have to stimulate the heart muscle to beat, and that's what causes the contraction that makes the heart disperse blood from one chamber to the next and then out to the rest of the body. So I think if you look at the coronary artery disease processes are like there's a problem with your plumbing. If you look at arrhythmias, like a problem with the electrical circuits in your house. If you look at congestive heart failure, more or less like if there was a problem with the structure of the the house itself, or the structure of the heart itself. In other words, in your house, say there's something wrong with the foundation or something's wrong with the walls themselves, the house may have problems with just the actual functionality. It may lean or it may be unstable. Well, in a congestive heart failure situation, that's similar to what's happening with your heart. It's weak and it doesn't function well. Coronary arteries is like if you have a blocked pipe in your house, like you have a blocked artery that transmits oxygenated blood to a specific area of the heart. You have 3 different arteries that supply blood to 3 different parts of the heart, and each needs that adequate amount of blood flow. So if something's blocking a pipe, that can cause a problem in your house. If you turn the faucet, you expect water to come out. Sometimes that water may just trickle, and the same thing can happen in your heart. You have a pipe that's partially blocked versus completely blocked, that can cause problems. And then if you have a problem with a heart rhythm issue, just like if you cut on a light and you see the lights flicker, they don't tend to engage well with seeing a full body of light coming out of a light bulb. If it's flickering, it can be annoying and it can be disturbing. Well, the heart can do the same thing. So I think if we look at it in those 4 categories, or say you have a door, and I've left out valvular heart disease, but say if you open a door and you close it, you expect that door to open and close well. Well, the door it closes, but it doesn't close completely, or when you try to open it, it takes a lot of work to open the door. Well, that can be similar to what can happen within the heart. So we'll stop there because I want to save the rest of our discussion for another show. But I want to at least bring to light, if we categorize heart disease the way I just described, I think that'll give you an opportunity to understand a little bit better what heart disease truly is. Thanks for listening. I truly hope this message has somehow helped you and will start you down a path of good health. I'm more than happy to answer any questions you may have. Email me at dr.newby@yahoo.com. That's dr.newby@yahoo.com, and I will read and answer your questions with the next podcast. Take care and God bless.